Hi Danielle, my name is Crystal. I'm a nurse practitioner, and today we are going to do a neural exam, and we'll be testing 12 cranial nerves. Okay, there'll be a series of tests. If you have any questions along the way, you can ask. Okay, that sound good to you? Perfect. All right, so we're going to start with cranial nerve 1, and that is the olfactory. That is a sensory nerve and it mediates sense of smell. So to test for that, I've got two scents here, and we'll have you smell each of them and make sure that you can identify those scents correctly. Before we get started with that, I'm going to have you close off one nostril at a time, breathe in and out, and let's just make sure that your nasal passageways are nice and clear. All right. Go ahead and cover your right nostril. Breathe in. Open it. Go ahead and cover your left nostril. Cover it. So cranial nerve 1, olfactory is intact. We'll move on to cranial nerve 2, which is the optic nerve, and that is also sensory. It is, well, there's 3 tests that we'll do. First will be for visual acuity. Then next we're going to test your a visual field test with the confrontation test. And then the next thing I'll do is a fundoscopic exam with the ophthalmoscope. And what your optic nerve does is it transmits all visual information and conducts visual impulses. Okay, so the first things first we're going to do, I'm going to give you this to cover your eye. Do you wear glasses?
No.
All right. So we'll have you move over this way. I do have a smelling chart here. So I want you to have a seat and you can go ahead and read the smallest line that you're able to see from right to left. And if you'll cover your right eye first, and we'll start with the test of the left. D, E, F, P, O, T, E, C. Perfect. And go ahead and cover the left eye. And with your right eye, you're going to read right to left. D, E, F, P, O, T, E, C. Perfect. So we've got 20/20 vision bilaterally with no corrective lenses. That's good. Come on back over here. And we'll move on to the vision field test. Like I said, with confrontation, we're going to do that one eye at a time. And so what we're doing here is testing your visual field. So if you'll cover your right eye, and you can just focus on the blinds um, right behind me, okay? And I'm going to hold up fingers in your visual field, and I just want you to tell me within the 4 visual fields how many numbers. Okay? Okay. 1, 2, 2, 2. Perfect. We'll do the same thing with the next side. Okay. 2, 1, 1, 1. Perfect. And so you had full visual fields and you were able to tell the numbers in each. We'll move on to the next portion of this part of the exam, which will be the fundoscopic exam. That's where I'm going to look at the structures of your eye with the ophthalmoscope. So I'm going to have to get a little close to you. Okay, so just look straight ahead. Light might be a little bright, okay, but I'll be close to you. Good. Right reflex. All right, we'll take a look at the next step. here we'll talk about the findings. I saw a nice orange retina bilaterally. We've got a nice white, creamy optic disc. The disc is nice and distinct. Um, Saw red reflex bilaterally. All these findings are bilateral. I didn't see any cotton wool bodies. There was no swelling of the disc. I didn't see any increased cupping of the disc, no hemorrhage. And looking at the vessels, the arteries were larger than the veins, or no, the veins were larger than the arteries at a 2-to-1 ratio, which is perfectly normal. Um, and there was no increased tortuosity, which would be an indication of diabetic retinopathy. So all normal findings there. Okay, so optic nerve is intact. We'll move on to cranial nerve number 3, which is ocular motor. With that, we also test cranial nerve 4 and 6. Cranial nerve 4 is trochlear, and cranial nerve 6 is abducens. And those are all motor. Your oculomotor nerve mediates the pupillary size and levator function, the movement of your eyelids, and the cranial nerve 4, the trochlear mediates inferior eye movement with the superior oblique muscle, and cranial nerve 6, abducens, mediates lateral eye movement with the lateral rectus. So the first test that we're going to do is just looking at your pupillary response. And we do that with a pen light here. So I'm looking at your pupils. I'm just looking at size, shape, and how your pupils react to light. So just on a quick exam, just looking at the pupil size, they are nice and round, about 4 millimeters bilaterally. And so to check for reaction of light, we'll do 2 different things. So direct light, where I'm shining this right at your left eye, nice brisk reaction there. And then the consensual is where I shine on your left eye, and I do see a consensual constriction there on the right eye. It does constrict as well. So we'll do the same thing with the right eye, where I'm going to put the light directly there. I do see a nice brisk response. And then we will do the consensual, where I shine the light on the right eye, and I do see brisk consensual constriction on the opposite eye. So that looks great. And then we'll do the test for accommodation. Now I'm testing for accommodation. I just want your eyes to follow my finger. Come in, I do see both of the eyes converge, and I do see constriction there in both of the pupils. So there the findings are. The pupils are equal, round, reactive to light, and accommodation. Those are normal findings. The next test that we'll do is the corneal light reflex test. So that's where I'm going to shine the light right there at the bridge of your nose. Look straight ahead. And I do see symmetric corneal reflex, where the light is reflecting symmetrically on both eyes. No misalignment there. So that's a normal response. The next thing we'll move on to is the 6 cardinal gazes. Okay, so what I'm going to have you do is just look straight at me. You're going to follow my finger. Okay. Perfect. So there I see nice, full, smooth movement. I don't see any nystagmus, no paralysis in either eye. goes to normal. And then that one, we're going to move on to the cover and uncover test. Okay, so I'll go ahead and use this. I'm going to have you just focus on like the one spot on the blind. Just kind of focus on that spot on the blinds right behind me. And with the cover uncover test, I cover, uncover, uncover. And so there, I don't see any movement of the eye to pick up fixation. So continue to focus on that spot for me. Cover, cover, uncover, uncover. And again, don't see any movement to pick up fixation. So those three cranial nerves are intact. We'll move on to the next cranial nerve, which would be cranial nerve 5, and that is trigeminal. Now, that nerve is a mixed nerve, so it has sensory and motor function. For the motor function, it mediates muscles of mastication, and the sensory, it is mediates sensations on the face. Okay, so just to test for the muscles of mastication, I'm going to have you bear down, clench your jaw, all nice and tight. And I'm palpating the temporals bilaterally and bilateral jaw. Nice, strong movement as you clench down. That is intact. And if I can just have you kind of move the bottom of your jaw right to left, up and down. And I don't see any limits in range of motion there. So that part is good. Then the next thing we're going to do is test your sensations on your face. So the eyebrow, cheek, and chin areas, okay? There's two sensations that I'm going to test for, dull and sharp. You give me your hand, kind of sharp, and that's dull, okay? So I'm going to have you close both of your eyes, and I'm just going to lightly touch your face with either sharp or dull, and I just want you to tell me what you feel. Sharp, sharp, dull, sharp, dull. Perfect. So you were able to appropriately distinguish those sensations. So we'll say that cranial nerve 5 is intact. We will move on to cranial nerve 7, which is facial. That is also a mixed nerve, sensory and motor function. And with the facial nerve, we've got the sensory portion, which is it mediates sensation or taste on the 2/3 anterior portion of the tongue. And for motor function, it mediates muscle movement in the face. So we're going to test some different muscle movements. So I'm going to just have you do a few things, okay? We'll go ahead and have you raise your eyebrows, wrinkle your forehead, squint your eyes, go ahead and smile real big, round, clench. Perfect. So movement was intact, symmetrically and bilaterally. No asymmetric findings, and all the movements were smooth and what they were supposed to be. So we'll say that cranial nerve 7 is intact. We'll move on to cranial nerve 8, which is acoustic. That is a sensory nerve, and acoustic nerve mediates your sense of hearing. So there's going to be 3 different tests that we're going to do to test for that. First one is going to be the whisper test. So what I'm going to do is have you occlude your left ear. And I'm going to whisper some words on this side. I want you to tell me what I'm whispering, okay? Cram, bread, for that one. Right ear, mop, broom, red. So you have appropriate response to the whispered word. So no defects there. We'll move on to the next test, which we're going to use the tuning fork for this. So the Weber test tells me whether or not you have a louder sensation on either side or if it's equal. So, sound equally? Yes. So no lateralization of sound there. We'll move on to the next test, which is the Rennie test. And what we're going to do on this test is time. We're going to time how long you hear sound when I place it on your mastoid process versus how long you hear sound when I put the tuning fork right in front of your ear canal. Okay? Okay. 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 So that's perfect. And looking at the times where you heard the sound, it was longer when it was when the tuning fork was right in front of the ear canal, which means that air conduction is greater than bone conduction. So that would be considered a normal finding. So that was normal bilaterally. We'll move on to cranial nerve 9 and 10. And those cranial nerves, we have the glossopharyngeal and we have the vagus. Those are also mixed, sensory and motor. The glossopharyngeal test that nerve mediates the sense of taste in 1/3 posterior portion of the tongue. And what the vagus is the motor function of the vagus nerve is to mediate movement in the posterior portion of your mouth. So a few things that we test for that. I want you to open your mouth really wide for me and say ah. Say it one more time. Ah. Perfect. And the uvula rises midline. There's no deviation to the right or left, so that is perfectly normal. And then the next thing we're going to test is here. Go ahead and open really wide. Perfect. That's our gag reflex. The gag reflex is intact. That's good. And the last thing that we're going to test with that is the your swallow. Yes. So go ahead and take a sip of that drink and you'll go ahead and swallow for me. Perfect. So I don't see any tracheal deviation. Nice and midline. Your swallowing is good, intact. We'll move on to 9 and 10. Let's move on to 11, which is the spinal accessory, cranial nerve 11, spinal accessory, which is motor. And so that mediates the movement of the trapezius and the sternocleidomastoid. So to test for this, I'm going to put resistance down on both of your shoulders. I want you to push up against the resistance. Perfect. So you were able to push against full resistance bilaterally, so that's fine. Next thing I'm going to do is press up against the side of your face, and I want you to push against the resistance. Perfect. Here. Perfect. So you were able to push against full resistance on the neck. So that nerve is intact. We'll move on to cranial nerve 12, which is the hypoglossal. And that is a motor nerve, and that mediates movement of the tongue. So we'll have you stick out your tongue for me. Stick it out just like that. Perfect. And it is nice and midline. I don't see any tremor and no deviation. So that's good. The next thing I'm going to have you do is press your tongue up against my finger. Perfect. So nice strong movement of the tongue bilaterally, and that nerve is intact. That concludes our neuro assessment. Did you have any questions for me?
No.
Thank you.